Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the 180th episode of the Codecast podcast. Today, my name is Terry Fletcher. First, I wanted to apologize. I'm a little bit under the weather. I did catch a cough and a cold. I've never had allergies, but we've got a lot of wind, and the cold, hot weather keeps going back and forth here in California. So if my voice kind of cuts in and out, I apologize. I will definitely put myself on mute if I need to cough quick. But you know me, the show must go on. So here I am. So today I'm going to do something a little bit different. Usually, you know that when I get to the end of the month, we've got Talk 10 Tuesday, but I really wanted to talk to you about something that I've been dealing with, and I think it may extend to a lot of my healthcare compadres at home, a lot of healthcare professionals. I know it's a lot of different employees are dealing with it just throughout the country. And what we're talking about are the boundaries between home and work, especially during the pandemic. Many of you have had to pivot from working on site at your office and now, working from home, which I think for some of us has been great because, you don't have to drive, you're protecting yourself from the COVID. And that was the whole point of it to start, not only protecting you, but also protecting patients in the healthcare field. The problem is that then something came along called Zoom. Now, have you ever heard of Zoom before this year or the last year? Most of us heard of Global Meet. We've heard of GoToMeeting, things like that. And of course, you know FaceTime and Skype. But when it comes to having meetings and having team calls, or if you're and anybody wants to talk to you from your office, whether it be your boss who's also working, from home or anything like that, it seems like Zoom calls are more frequent. And there are a lot of blurred lines between work and home, and I'm not seeing any boundaries. And especially for me, and I actually am a culprit of this as well, where I'm sitting here today and I'm getting ready to record and I'm thinking, wow, I've done 8 Zoom meetings this week with clients. I've got the AAPC convention next week and I'm going to be attending virtually. And that is 9 sessions all through Zoom. And then I've got different platforms where I'm dealing with as well. I'm not just doing Zoom. I'm doing, PGI, and I mentioned GoToMeeting and Beacon Live, and you name it. But the digital information is just crazy right now. And now because everyone thinks that we're working at home, that we can just, for example, I also do another podcast called the Edge Podcast with the NSCHBC, one of my organizations that I'm a part of. And the person that I'm going to be interviewing, who I adore, well, she's on the East Coast and I'm in California. So I'm the one getting up at 5 o'clock in the morning to accommodate somebody to record at 6 a.m. And then I'm going to be attending an all-day virtual meeting for the APC conference right after that. And I'm sitting here thinking, wow, this is just crazy as far as how we are working all the time. And I just wanted to talk to you about that because I was reading an article right as I started thinking about all this. And one of the companies out there at Citibank, and you may have a credit card with them, I know I do, and they basically have decided that they are going to ban Zoom on Fridays. And the CEO, Jane Fraser, she says that people are just working too many hours and it's taking its toll. So I wanted to talk to you about that because Citibank is the 3rd largest bank in the United States. And they just made this announcement that they said they're going to eliminate video conferencing meetings on Fridays for over 200,000 employees. And the rule applies to internal company meetings only. So they said with customers and regulators and other outside entities, they can still schedule some things, but nobody will have to turn their camera on if they're outside entities. But the internal group, they just said, we've been really looking at how people are focusing, how people are doing their work, and we're noticing that even though they are at home and it's a little more convenient, some of the work oversight hasn't been good. And they said one thing that's really been a problem is focus. Let's face it, the pandemic has wearied all of us. And in the memo that she wrote, she said the blurring of lines between home and work and the restlessness of the pandemic workday has really taken a toll on our well-being. And it's true. And it's not sustainable. And I just want, if I've got administrators and office managers and frontline workers and, anybody who's dealing with some of these, even telemedicine, it's just really tough sometimes. And since a return to any kind of new normal, we're still a few months away from that. But for many of us, but we need to reset some of our working practices if we're going to sustain any kind of focus. And this may be especially necessary in the healthcare industry and the financial industry, because a lot of the analytics that I've seen on this is that many people, and I know I do, we are working more than 100 hours a week now because we can. I can go to bed at night and I'll sit there and think, okay, I got off early today. And again, I'm remote working, so I have a dedicated space in my home. I have a home office. It's actually bigger than my master. And so I'm working on this. And it's interesting because I'm thinking I work 100 plus hours a week, and I could be in my room and my bedroom thinking about, okay, it's just across the hall. And what I could do is I could go record 2 podcasts. I've got auditing to do. I really need to work on that PowerPoint. And then my mind goes crazy. And so we've got to be watching this, this mindset, because when our regular work schedule spills over into nights and very early mornings and now weekends, it really can prevent us from recharging fully. And that isn't good for you. And it's really not good for your employer either. In addition to them, then again, I'll refer back to Citibank. In addition to them saying no Zoom Fridays, the memo encouraged employees to take your vacation time and urged them to stop scheduling meetings and calls outside of business hours. And so I'm very accommodating to clients. And so I have extended business hours. But when I start to get these calls on Sundays and expectations at 10 o'clock at night, just because people know me, it's interesting where you have to take a step back. And I'm just going to say, for those of you that are out there, make sure that you take Memorial Day off. Take it off. It's in May. And we are getting so far ahead of the vaccine at this point, you need to reset. And so if that is a holiday that you celebrate as far as getting the day off, please use it, because sometimes you're also getting that text. You're always on your phone. And what did it used to be? It used to be you couldn't wait to get off work, so you stop by the grocery store or stop by, picked up dinner, or you grocery shopped over the weekend, and so you're going home and you're going to cook something for your family, and you left work at work. We don't get to leave work at work anymore. Why we're cooking dinner, or why we are, stepping out of our office space in our house, we've got, kids or family or husbands or spouses or partners and everybody basically coming at us as we're still looking at our phones. Did that text get done? Did that email pop up? My Zoom call? Did I get on that at the right time? Did I finish up afterward? And so, we have a light at the end of the tunnel. Widening the vaccine distribution and means fewer COVID deaths, means fewer hospitalizations. As we've already seen, they're down 21% from hospitalizations in Texas, 32% in Florida, and they're wide open. They're down 28% in Arizona, and I'm reading right from the CDC right now, and even California. And they're still, I don't know when they're going to open our state. I think most people just said, hey, we're going to be open. We don't really care what anybody else says, but we're down almost 18% here, which is huge because of our per capita. But as we enter this final stretch, and people's nerves are frayed and patience is wearing thin, now is a great time to give people some downtime as we figure out what comes next. And, everybody likes to say, look at the science. Well, Zoom really is exhausting. And so are digital platforms and meetings. You've heard the term Zoom fatigue. That's been around nearly as long as the pandemic has, but it got some kind of street cred earlier this month when a Stanford professor who did some research to explain why Zoom meetings are tiring people out more than in-person meetings are. And his conclusions about this was the fact that it's exhausting because the conversations are unnatural. First, you find yourself staring into the face of another participant throughout the entire conversation. in a way you would never do, let's face it, especially if you were in the same room with them. And if you did, that would be kind of creepy. Next, in addition to looking at them, you're also looking at your own image. I mean, sometimes I'll put a photo up because I'm like, no, I just don't want to do that today. And you're gazing into a mirror all day. And third, and it's more difficult to pick up on nonverbal cues than it would be if you were in the same room, but that also happens. People can see you roll your eyes. They can see you take a drink of water. But you have to work harder to understand other people's nonverbal communication and put more effort into making your own nonverbal communication, like a thumbs up or a smile all the time. And otherwise people will pick up on that. And another problem is that, and this is a big one, and I'm actually starting to feel it, is that you're trapped in one place, especially if you're using a computer. Even if you're on a mobile device, moving in and out of the frame or moving around with your device, that can be distracting for other participants. And most of us don't do it. We sit on the computer and stare. And we also don't feel comfortable stepping away to use the restroom or fetch a glass of water, or even, as they might hesitate to do these things in an in-person meeting, usually people will say, I'll be right back, and they'll step out for a second. But this is just kind of interesting because a lot of times Zoom meetings can be scheduled back to back with no break in between. Whereas in real life, you're likely to leave a little time to get at least a break from something. I'm sitting here looking at even my conference with the APC on Monday, and there's actually a 10-minute break in between, but that's not very long when you're on the computer and if the class actually goes over. And so, you add it all up, and there's no question that video conferencing is contributing to a lot of the remote work burnout. And I'm sure a lot of you feel it. So giving everyone one day a week when they don't have to deal with it will make a really big difference. So have a meeting-free day. It helps everyone get more done. Let them focus on doing other things that is not about talking to people, looking into the computer, having to look good into the computer. And really, before people even heard of Zoom, a lot of people did ban meetings on certain days. A lot of people like to leave early on Wednesdays. When there was no pandemic and no reason, colleagues couldn't meet as they always had. Basically, remember what we had? We had conference rooms and coffee, and, we'd chit chat with each other about who watched The Bachelorette the night before, or, who watched a baseball game, or with me, of course, it's my Pittsburgh Steelers. And meetings were still a drag, but at least you got to have that interaction. And now it's tough to do that because you're not sure if they're recording. You're not sure if you're interrupting somebody who comes in, and you can't keep, a conversation on longer than a minute because you all show up at the same time. So the benefits of at least trying this, and I wanted to bring it up just as we're now into spring. We've hit the first day of spring. We're ending the first quarter of the year. We're seeing a light at the end of the tunnel. And it's time to try and regroup, refocus, and just give ourselves a break. So whether in person or by video or a meeting-free day, this is going to help you who working remotely to just make sure that you kind of give yourself that mental break so that you can do your job better. That's all I'm putting out there. I wanted to do that just for the healthcare workers who think that nobody really understands how they feel. I do. I'm feeling your pain here, and I just want you to know that I hope that just talking about that really helped, and you bring this to light to your administrator. Just say, listen to Terry on this last month and see what you think about that, because the large corporations are doing it, and so we could probably take a little page from them and maybe be a little bit more understanding when it comes to that. Okay, so I did want to have a coding question today, and I wanted to finish up on my cosurgery FAQs. I've got two more. So when we were talking about billing for cosurgery, I really focused on CPT, but a question came up that what if my surgeon served as a co-surgeon with another physician, and I called to double check, are we submitting the same CPT code, which you should? Should you also ask about the same ICD-10-CM code? The answer is yes, because each physician must link the same diagnosis code to the common procedure code when using the modifier 62. So in other words, if two physicians are co-surgeons for one procedure, the diagnosis code they link to that CPT code should be the same. Now, double check cosurgery indicators. And this is my last tip. This is a really big one. So the 62 modifier, what is an indicator? So first of all, this is kind of like when we look and see if something has a professional, a technical, and then a global service, or if it has an indicator as well, if it is under direct or personal or general supervision, or if it has an indicator for a CCI edit. We need to know certain indicators are on the physician Medicare fee schedule. And so a cosurgery indicator is very important because it tells you whether the procedure you're reporting even qualifies to put a 62 modifier on. So if you're looking at the Medicare fee schedule database, you're looking for a Medicare cosurgery indicator of 1 or 2. If the indicator is anything else, you cannot bill for a cosurgeon. So if you find a code that carries a cosurgery indicator of 1, you must supply documentation to establish medical necessity for 2 surgeons. Only when you establish that medical necessity clearly will the payer consider additional reimbursement. You should also present which circumstance in the procedure required special skills or the expertise by 2 surgeons or 2 physicians sharing responsibility. Now, the indicator 2 in the cosurgery column indicator means that you may append modifier 62 as long as each of the operating surgeons are of a different specialty. So that's a big one. So it's not necessarily needed with indicator 1, and it's different columns. So when you pull up in the Medicare fee schedule, and you can do it online, you can actually Google it for your jurisdiction, it'll give you a full line item. It'll tell you how much it is, if it is facility versus non-facility, if it's professional versus technical, and then you will get all these different columns for indicators. And this is a big one as far as if you have a 1 or 2 indicator. So make sure that you are really looking at that whenever you're using that 62 modifier. That's going to be really important. Okay, everyone. Well, I knew I was going to make it kind of a quick hit today because I wasn't sure how long my voice would hang out. I am feeling better. It's been a rough week, but hopefully next week we'll be on the upswing. And I hope everyone really makes it a great week and a great rest of your day. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.